Mike, how would you rate cooperation between the partners in the sector?
The collaboration here is strong. As with any family, you have ups and downs, and you have times when you don't see everything eye to eye, but that's actually healthy. If we all felt the same about every issue all the time, it would be a bit boring and probably a bit worrying. And I think we're trying to become more strategic, trying to have perhaps a more limited number of targets for the year, and try to make sure that as partners, collectively, we achieve those partners. We work under the leadership of the government, and that's always very important that we respect that and we recognise that. And so again, in terms of judging what our contribution is, we need to see it as contributions to the sector being led by the government rather than whatever we're doing individually. The challenge, I think, is more implementation, trying to make sure that commitments which are made are actually implemented in practice. And in fact, it's quite exciting and encouraging. If you look at the results of the Kenya Demographic and Health Survey, you see some very spectacular improvements in infant and under 5 mortality. The economists would perhaps say, well, actually what was really key in that period was strong economic growth, which clearly contributed. So I don't think we should ascribe all of the improvement in health status just to what happened in the narrow aspect of the health sector itself. But be that as it may, we saw some major improvements. That has posed challenges for coordination and made things more difficult. I like to think now that there's been a settling down and the two ministries are now working together. My expectation is the two ministries at some point will merge now that we have a new constitution in place.
What strides do you think the health sector has made in regards to the Paris Declaration?
We have quite a comprehensive, some would say perhaps too complicated structure of inter-agency coordinating committees. So we have the structures in place. I don't think anyone wants to go back to the old situation where you have highly fragmented support and individual partners working in individual ways. Everyone is committed in principle to the Paris Declaration, to the Accra Principles and so on. But I think there's a consensus that unless you can strengthen the systems across the sector, there's going to be a limit to how much further we can obtain benefits. The private sector getting closer to the action, if you like. Particularly the faith-based organisations, they've been looking at how to collaborate with partners and with the government more closely. But in the last year or two, we've seen a very strong interest from the for-profit private sector too. Many of them have now signed the Code of Conduct, just like the faith-based organisations. And once you sign the Code of Conduct, you are essentially signing up to participation in the swap process. But the new health financing strategy in particular is a very big opportunity for the private sector to be playing a larger role and a different sort of role in terms of contributing to the health sectors. Again, as I said before, 2008 was a difficult year following the disputed elections. But in 2009 we resumed the process of project preparation. And out of that came a decision by the World Bank Board in June of this year to approve $100 million for the health sector in Kenya. And slightly less, nearly half of the funding is for the new Health Sector Services Fund, which is essentially to do what I mentioned earlier on, to get funding to go down to the local level, so there are resources available. The other half of the World Bank support is to strengthen the KEMSA. The argument being that if you can do two things, if you can essentially get resources flowing down to the local level and you can improve the supply of pharmaceuticals and commodities, then you ought to be able to have a significant impact on the health of local people. Five years ago, there was a lot of tension on a number of issues, particularly on health financing strategy. There was not a meeting of minds at that stage between partners. There was a lot of disagreement within the country generally between government and non-government and even within government on what is the best way to finance the health services. And I don't think my German friends would mind me saying that there were very strong views on all sides, including on their side. But one of the things that I think we're proud about is that we brought together the different partners and everyone took stock and said, look, we want to be helpful to the Kenyans. It is not being helpful if we are diversive and if we are fighting. So we actually wrote a draft note which was later subscribed to by all the development partners, saying about how we should be working together in the sector. And even where we have technical differences of view, we need to recognise the government leadership, we need to recognise that these are issues for the Kenyan people, and we need to recognise that there is no one perfect health financing system. The GTZ has been focusing to a large extent on policy issues, along with World Health Organization and other organisations too. I think has positioned us as well. We have different areas of expertise. On the World Bank side, perhaps we're stronger on financing issues, on expenditure analysis, resource allocation, and so on. But the partnership has been close, and I think that it's been to the benefit of everyone. Also with KFW is working closely, as you know, on the commodities side, on the family planning side, and so on. And that has nicely mirrored what we've been doing with the KEMSA as well. So collaboration has been very good. As I said before, nothing's ever perfect. And the moment we start thinking that we're perfect, I think we should pack up and stop, because it clearly isn't the case. But we have a degree of trust and a degree of honesty with each other. So wherever we do have slightly different perspectives, we can put those on the table and try to discuss why that is. I do think the new constitution will open up new opportunities through the Bill of Rights, through decentralisation, through changing the role of the Ministry of Health into focusing on policy formulation, accreditation, and so on. I think it is quite possible for some major strides to be made. Again, it does come back to leadership on the government side. It does come back to partners following through on commitments that they've made. It does come through to all of the different stakeholders in the sector working together.